The urinary tract. The primary function of the urinary tract is the formation and excretion of urine. Urine is formed by ultrafiltration of blood in the kidneys. From the kidneys, the urine flows into the renal collecting system, the renal calyces and pelvis, and passes through the ureters before it reaches the urinary bladder. The urinary bladder serves as a receptacle for the urine. The urine is stored in the urinary bladder for several hours and then discharged from the body through the urethra. The formation of urine in the kidneys is accomplished in the nephron, which represents the basic functional unit of each kidney. The kidneys contain approximately 2.5 million nephrons, each of which consists of a glomerulus, tubules, and collecting ducts. The glomerulus consists of specialized capillaries that are modified so that they allow selective passage of fluids and solutes from the blood into the lumen of the nephron. This primary filtrate is modified during its passage through the tubular parts of the nephron, which are known as the proximal and distal tubules, loops of Henle, and collecting ducts. Most of the fluid filtered in the glomeruli is actually resorbed and returned to the circulation. Because the primary filtrate is concentrated in the tubules, only a small portion of it is excreted as urine. Approximately 1.5 liters of urine is excreted daily, which represents less than 10% of the blood volume filtered through the glomeruli. In contrast to the complex histology of the kidneys, the excretory portion of the urinary tract is relatively simple. The calyces, pelvis, ureters, urinary bladder, and most of the urethra are lined by transitional epithelium. The transitional epithelium is waterproof and can withstand prolonged exposure to urine. External to this epithelial layer, these organs consist of connective tissue and smooth muscle cells. Transitional epithelium and the smooth muscular wall can expand, allowing the bladder to store urine. The smooth muscle in the bladder wall is important for extrusion of urine during micturition. As mentioned, the urinary tract primarily has an excretory function. In addition, the kidney has secretory functions. It secretes renin, a hormone that raises blood pressure, and erythropoietin, the growth factor that stimulates the production of red blood cells in the bone marrow. 1. The primary function of the urinary tract is to form and excrete urine. The kidneys must be anatomically normal to perform their normal function. However, the formation of urine also depends on sufficient blood flow and adequate hydration of the body. Several polypeptide and steroid hormones also regulate renal function. The most important hormones are antidiuretic hormone, ADH, which is secreted by the posterior pituitary, atrial natriuretic hormone, ANH, which is derived from the atria of the heart, and aldosterone, which is from the zona glomerulosa of the adrenal cortex. Once the urine is formed, it can be discharged only if the urinary passages are patent. Any obstruction of the ureters, like owing to urinary stones, or of the urinary bladder, owing to an enlarged prostate, secondary to hyperplasia, will result in retention of urine. Failure of the urinary tract is to produce normal amounts of urine that may be classified as prerenal, renal, or postrenal. Prerenal renal failure is most often caused by shock or heart insufficiency. Prerenal failure is usually reversible, and if its cause is cured, normal renal function can be restored. Intrarenal causes of acute renal failure, such as tubular necrosis, are also reversible. Although chronic renal failure previously was lethal, modern technology has made it feasible to treat even irreversible renal failure with dialysis machines or through renal transplantation. Postrenal causes of renal failure, such as prostatic disease or stones in the bladder, can be treated surgically. 2. The urinary tract is extremely sensitive to bacterial infections. The kidneys are perfused constantly by a high volume of blood, which is filtered in the glomeruli. Bacteria found in the circulation thus have a good chance of entering and colonizing the kidneys and causing a urinary tract infection, a UTI. Moreover, because the urethral opening lies external to the body, bacteria may easily enter the urinary tract through it as well. UTIs that are acquired from bacteremia are called descending or hematogenous infections, whereas those attributable to upstream bacterial spread are called ascending infections. 3. Glomerular capillaries, although they are highly specialized, are nevertheless part of the circulatory system. The glomeruli are affected by many diseases that involve the vasculature. Although atherosclerosis, which is the disease involving the larger arteries, does not affect the glomeruli directly. The narrowing within atherosclerotic renal arteries and their branches produces secondary changes in the glomeruli and their obsolescence, glomerular sclerosis. Renal arterioles and glomeruli are often pathologically altered by hypertension, which may damage the kidneys irreparably. Diabetes mellitus, a common metabolic disorder of intermediate metabolism, affects the capillaries and arterioles in many organs. Hence, it is no surprise that this microangiopathy often damages the glomeruli as well. 4. Renal tubules are composed of highly specialized cells that are very sensitive to a lack of oxygen and to the adverse actions of toxins. Like all other highly specialized cells, such as neurons, renal tubular cells require a constant supply of oxygen and nutrients. Even a short interruption of blood supply, or a hypoperfusion of the kidneys, as typically occurs in shock or heart failure, results in tubular necrosis, because the proximal tubular cells have the most complex function and require the most oxygen. They are most susceptible to hypoxia or anoxia. Many drugs, poisons, heavy metals, and endogenous waste products that are filtered through the glomeruli are taken up by the proximal tubular cells and may adversely affect them. For example, mercury salts inactivate the enzymes of the proximal tubules and, if ingested in large amounts, in suicidal mercury poisoning, can cause necrosis of the proximal tubules. 5. The urinary tract consists of many mitotic or facultative mitotic cells that may undergo malignant transformation. Tumors of the urinary tract develop most often in the urinary bladder, which is lined by regularly cycling mitotic cells. As with most other tumors, the causes of urogenital tumors are not known. However, because the urinary tract serves as a route for the excretion of chemicals, many of which are potential carcinogens, it is possible that some tumors are chemically induced. It has also been postulated that some tumors originate from the interaction of chemical carcinogens and indigenous proto-oncogenes. In support of this hypothesis is the finding of chromosomal changes in many renal cell and urinary bladder carcinomas. Wilms tumor, the most common urinary tract tumor of infancy that shows a familial preponderance, has been linked to a deletion of a specific tumor suppressor gene in about 15% of cases. 6. Diseases of the urinary tract may present with local or systemic symptoms. Diseases of the urinary tract produce a variety of symptoms that may be either localized to the urinary tract or systemic, affecting the entire body. The best known local symptom is the flank pain that occurs with kidney infection or renal tumors. Painful urination is the best known symptom of cystitis. Urinary colic is a symptom associated with urinary stones impacted in the ureters. Colics are attacks of spasmodic pain that occur as the ureteral smooth muscles contract in an effort to propel the stone and relieve the urinary obstruction. Thank you all for watching this video. I'll have more videos on this topic, including polycystic kidney disease, glomerular diseases, and metabolic diseases. Again, thank you for watching this video, and I hope you learned something new.